Thank you for having me today. My name is Melissa Alphonse. I run what's called the Goldstone Caregiver Center here at Norwalk Hospital. We just merged with Norwalk, so now a part of Norwalk as well. Before we were Norwalk, this mission was a huge mission in New York where there's about 10 caregiver centers. And what they do and what we do is we provide emotional support to anyone that's caring for a loved one, whether they have an affiliation with the hospital or just a caregiver living in the community. So with that being said, now that we have merged with Norwalk, we are a total of 13. The Goldstones are our donor, and they were very generous to donate the money to Danbury Hospital first. And Danbury's Goldstone Caregiver Center has been operationalized for 11 years. And they loved what they did with it so much that they decided to donate money to Norwalk Hospital, and we've been operationalized for 4. How I like to explain it is when someone comes into the hospital, we have the doctors and the nurses who are taking care of the patient. Who is taking care of the family? And so I'm gonna stop there and I'm gonna ask you a question. Have you ever had a family member or a friend hospitalized, and how was that experience for you, good or bad? Anyway.
No matter what, Tyra.
No matter what.
Yes.
Yes.
Well, entering the hospital through the ER is a joyride to begin with. So I would just say incorrect diagnosis initially, and from then on, you call somebody else to come in and fight for you.
Thank you. Anyone else? How?
I would just add a little perspective in support of what you're saying. I used to work at a continuing care retirement community down in Rye called the Osborne, and I always noticed that when couples would come in, move in, and then one of them would become ill, the caregiver became more and more fragile, and there were a number of cases, these were people who were in their 90s, but a number of cases where the caregiver would pass away. And the person who was ill remained because the caregiver had so much stress on them. And so I've always said to people, be cautious about this. You've got to take care of yourself.
Awesome. Thank you so much. One more person. Good or bad experience?
It's a little bit of both. Yeah. Each case. You'll have a great nurse or somebody will walk in and not have a great experience. So it's a combination. Never really count.
I often ask that question because for the people that have a bad experience, you are the reason why I exist. I like to say that we are a concierge service. Nothing is too small, nothing is too big. I have family members that come down and say, I've been with my loved one all night, I slept over, can I just please have a cup of coffee? You're welcome into our center just for that. You have some that come and say, I feel burnt out, I'm losing myself, can I speak to someone? I myself as a social worker will sit down, I'll process what they're going through. And the good thing about the service is it does not stop there. Continual conversations, they can call as many times, it's completely free as long as within the operational hours, but there's nothing too little, nothing too big at all. I do have volunteers that walk around and go into the rooms to also check in on the families to see how they're doing, just to say hello. Sometimes a friendly face, just so someone knows that you are here and you also need to speak to someone as well. So just to say hi, how are you, and to also give a pamphlet to say if you don't want to talk now, we respect that, but we are here and we're here to help you. Any questions so far? Yes?
How do you work with the chaplains there?
Very good question. So we refer to each other. Chaplains will, so if I have a family member that says I would like some spiritual guidance, I refer to the chaplaincy. If they say, well, I'm looking to speak to a social worker, we need more resources, or we need a private space, then the chaplain will refer to the Goldstone Caregiver Center. The difference is that we have a physical location within the hospital. Our location has a total of 3 private rooms, a conference room. Each private room has a massage chair. So when our families come in, they really have a space where they can relax, they can recharge before going back into the room. They can take Zoom calls, because a lot of times we do still have working families that are still working while caring for their loved ones. So they utilize those private rooms. And then we also have a huge conference room where if they need to meet with the doctor, they're able to meet with the doctor, have that meeting, and then the doctor's able to give a soft handoff to myself if there's any extra resources that is needed. There's also a computer room, so if anyone needs to check their email, print any applications, they have that as well as our snacks of the week, because that's always important. We like snacks.
Unless I kind of hone in on the massage chair. Does that come with a masseuse? I mean,
It's automated.
It's
Not a
automated.
table.
it's a corner operation.
Not at all, we are completely free. So within each private room, our private room setups look like like a living room. And so we like it to look like a home away from home. So when you walk into the center, it looks like your living room. So that private room will have a couch, the massage chair, maybe like a one-seater, as well as a middle table, a plant. So it's really that feeling of just going in and not remembering that you are in a hospital setting. So it look completely different than the hospital.
Sounds great.
Any other questions?
How large is your staff? How large is your staff?
Oh, it is me. So for now, it is me. I haven't, I built the program, I deliver the programs, I also do the marketing for the program. Hopefully down the line, I'll be able to have a part-time person. Danbury does have a larger staff. It's a total of 4. But for now, it is just me. Yes?
Do you do referrals for folks when they leave the hospital, or do you connect with an agency that does that?
Very good question. So I always ask a family member, have they spoken to case management? To ensure that we're not saying 2 different things. So I'll ask them if they're spoken to case management. I will explain the process as far as if you haven't met with your case manager, you will, and this is what they will discuss with you. Now, let's say I have a family member that comes from the community that does not have a case manager, and they say, you know, I have a home care agency, I would like to switch to a new one. Or, do you have a referral for one? Then I'm able to say, here's 3, pick whichever one you like, and let me know how it works out. And they can call, so they do their the own legwork. I don't physically call the agency for them. Any other questions? Yes?
Who's paying for all this? I mean, it seems to me that Norwalk Hospital isn't giving you the space because they got a budget, they got to meet it, and it occurs to me that the state's not paying for this. So who's paying for it?
Look at the name, look at the name.
We are completely funded by Stephen and Elizabeth Goldstone. Completely.
Wow.
What's the narrative there? I mean, there's gotta be a backstory.
So,
Okay.
really good questions. So the director of the Goldstone family had a family member who was ill in New York, Northern Westchester. And so throughout her experience, she was able to go into a caregiver center herself and experience it and understand how much it helped her throughout her process. And so she brought this idea to the Goldstones to say, we have to do something like this in Connecticut, let's bring it here. And Elizabeth, as well as Stephen, were so happy to say, we normally don't put our name on anything, but we believe so much in this mission that we're actually gonna put our name on it and kind of make it come to life.
So I just learned this, but I looked up Stephen Goldstone. He was the CEO of Nabisco. So do you get free Nabisco snacks?
I would think that he's retired.
That's pretty much.
Yes.
It's practice for life.
Do other local hospitals in this county have anything similar, or are you unique? I mean, like Stanford, the Yale New Haven network, no?
No,
Only New Vance now.
Norwalk, absolutely. So we were the first to bring this mission to Connecticut when we were New Vance, and now that we're Norwalk.
And did you say some of the Northwell hospitals private have it as well in New York?
Absolutely, they have a total of 10.
Yes.
So is there like a network that you're a part of, and like a peer group where you can best practices, shared stuff?
It's a good question. Yes. So every month, all of the caregiver centers meet. And so we talk about best practices, we talk about what's going on. We also talk about how are we gonna change things and streamline things together. Yes.
What's the most challenging part of what you do, and what would you say is your favorite part of what you do?
So I'll start with the favorite. The favorite part is having a family member come who is very overwhelmed, experiencing burnout, and say, these few moments that I was able to receive here helped me. So that would be the favorite. The hardest thing is not being able to reach everywhere, because I really do believe in this mission. A part of my story is I was a caregiver prior to this job. I completely quit my job, decided to take care of my loved one 24/7. And as a social worker that understood, healthcare and the ins and outs of it, it was a struggle. And so to be presented with an opportunity to say, well, you can help someone else. You can kind of, guide them through what you were going through. It's the most beautiful thing ever. So I truly, truly stand behind caregiver support and just helping that caregiver and understanding that in order to officially help the patient, it's 360. You have to help the caregiver as well. Yes.
Do you have any ties to or interactions with places like Ronald McDonald House or Gilda's House or any of those? Or
Nope. Not at all. It's just only in the hospital setting. Yes.
And your services are provided to anyone who's got a loved one in the hospital setting?
And living in the community.
I was gonna say, once they are discharged, do you still maintain contact?
Absolutely.
Okay.
So there is no timeline of how much of the services that you can receive. So let's say I have someone that's been with the Caregiver Center for the past 4 years. So he was my first person when I first started, and till this day, he still comes back to talk about what's going on between him and his wife. Yes.
Melissa, how is the traffic through your door? Is it where well, you give numbers if you like, but is it where you'd like it to be? Are you overwhelmed? Are you underutilized? I mean, compared to what you would like it to be.
So we serve monthly a total of 250 to about 280 caregivers a month. That is between myself as well as the volunteers.
Mm-hmm.
I am happy with that number, given that there's only one staff member. I would love for that number to grow as I continue to grow the programs and get more volunteers and more staff members through the door.
Right.
How many volunteers do you have?
So right now I have a total of 4.
Not that many.
Mm-mm.
So for that amount of people, it's like you're sending 7 people a day.
Yeah.
And how much time are you spending with each family?
It depends on how much time they need. So I'm not a person that is, when you are going through something, let's say you have a loved one in ICU that's about to die and you need to talk about it. Sometimes that person needs that extended time, and it's a very hard thing in mid-sentence to cut someone off and say, oh, I'm sorry, I gotta go to the next family. So the whole process is to just sit and process with that person until they are okay, and then to move on to the next. And the good thing about it is while I am processing with one family, the other families are sitting in the private rooms. They are recharging and waiting, and so it works out, really.
just how many private rooms and how long do people normally stay in the rooms, or what time frames?
It depends. I've had a family, so families who are really struggling will utilize that private room all day. So I've had to tell people, our private rooms are full. But that doesn't exclude, we do have a front waiting area as well that families are able to sit in. We do have a huge conference room that they're able to sit in as well. But there is no time limit. As long as there is availability, I welcome families.
24/7?
Not 24/7, great question. Monday through Friday. Monday through Friday, the hours are from 10 to 4:30, and that is only because it is just myself. Once we evolve, I'm hoping to have evening as well as weekends, because as we know, a lot of our family members visit after work and on the weekends.
So what kind of skill sets you look for your
population that would like to have a social worker or someone in the mental health field or someone who has a sense of healthcare. But I'm willing to train. What's important to me is that when a family member walks through that door, they are seen as a person and not a number. And so that's my biggest thing when I look for a volunteer or a staff member.
I assume that you only take people who are either family members of current hospitalized people or had a previous hospitalization, no?
No, you do
You'd be
not have to
inundated if
have
everybody
a.
knew.
Well, that's what we want. We
Yeah.
want it to grow. But no, you do not have to have an affiliation with the hospital at all. It is anyone that is living in the community that is a caregiver.
You mentioned that you're hoping to add somebody else. What would have to happen for that to be approved? Who approves that? Do you need more money or more donors or what?
Very good question. A couple of things. We look at funding, we look at budget. So just budgeting, working around the budget.
So how, I mean, it seems quite large. How many square feet are you, just out of interest, do you know? Roughly?
Good question.
I mean, it seems like a
Who's
big
the
place.
contractor here?
Somebody?
I want to quote that I am not a contractor. I want to say the center can possibly, do not quote me.
I'll have to come and pace it out.
Yes, but it may be about 1,100 square feet.
Mm.
On the smaller side, I would say 800. Yeah,
Sorry
on
for
the
the
small
difficult
side.
question.
It's okay.
The contractor would say bigger and charge more.
1,100 square feet.
That'll take more than 3 weeks.
Any other questions?
How do you experience renewal for what you do to stay compassionate? I had a colleague caution me as a pastor that you can go from a caring person to a careless person to a cruel person.
Wow.
And, you know, it happens.
They need a visit to the massage chair.
I think First Presbyterian need one.
So some of the services that I provide is self-care, stress management, and support groups. So my self-care is I take a minute to breathe. I always, always, always take a minute to breathe. Yes. Stress management, I will take a walk. Whether it's around the house.
That doesn't count.
I will take a walk. And that's what keeps me grounded. But also, I think I really do believe in the work. And so not all the time we're able to say, I come to work and I am behind the mission of my job, right? So for me, a lot of times, although a lot of the conversations are heavy, I understand the need and I believe in the need. Any other questions?
So did you open your center?
With help. So, but yes,
And did you have like training at the Danbury Center before you opened this one, or how does?
I'd like to say that myself and Danbury, we are like cousins and not identical twins. But we work hand in hand, we get along, we call each other, we bounce ideas off. And yes, when I first started, I spent about a week at Danbury with their manager there. And then I basically formulated everything from ground up at Norwalk, just because we do serve two different populations and to ensure that we have the services that Norwalk needs versus Danbury. Yes.
So you mentioned the community. Community, are you referring to Norwalk only or community in general?
Community in general, so anywhere from Greenwich all the way up to Bridgeport. Yes.
And you're not governed by any rules or regulations, or do you have to comply with any, I mean, besides from whatever the hospital asks for, but there's no state or federal thing telling you what to do?
No.
That's awesome.
Yeah.
But we do follow, like,
Good practice.
regular hospital state regulations. And you will see that there's a growing number in the state looking at different organizations and what they are doing for caregivers. That is a huge mission right now, to see how we can incorporate caregivers with patients or with clients to better get a, good outcome.
And I assume, I mean, she's credentialed as a social worker, and you have to maintain that credential, so.
You're just not having to fill out the forms.
In a similar vein, does the Goldstone, I don't know if it's a foundation or, but does the Goldstone Foundation, like a better word, provide oversight or some type of structure for your work?
No, so they provided the funding, and then our oversight comes from our hospital. So Northwell, as an entity with our other caregivers, we are now sharing and bouncing off ideas to say, okay, now that we're going from 2 to 13 caregiver centers within this system, how do we streamline a lot of the programs that we're having?
That's a Northwell. That's a Northwell.
Yeah.
Yes.
Something that Scott said earlier about, caregiver, but it can sometimes change as time goes on. If you do observe a situation like that, how would you address it, or can you address it?
So that's a very good question. So when you come into the caregiver center, my job is not to diagnose at all. So I do not diagnose, I provide friendly emotional support and guidance. And so if I notice that there's a caregiver that's burning out to a sense of, let's say they may need to be hospitalized, that is kind of having a gentle conversation to say, how do you feel your stress level is from 1 to 10? And allowing that caregiver themselves to come to the realization that I may need to either take a vacation or go into the hospital for a few minutes, not a few minutes, but to check myself in. But never to diagnose and never to tell them, oh, you need hospitalization. Yes?
What about working with the staff, given that they're all caregivers themselves?
So we provide emotional support to the staff as well. And what that looks like is a lot of times we have our staff members that may have had someone die on their unit. What does that look like? So I go on the unit, I check in on them. If they want to do a round table talk, just to get the feelings out, we set that up as well for the staff too. Yes?
How many people do you have coming in from the community versus within the hospital, the caregivers within the hospital?
That's a great question. I want to say I get about 60 to 80 from the community.
60 to 80%
Yes.
from the community?
No, persons.
Oh,
So if
people.
so let's say we have an even number, 200. We've serviced 200 people for the month. 80 of those people would have come from the community.
So you got your work out.
I'm trying.
That's a lot of volume.
Yeah, that's awesome.
200 a month, is that right?
260.
Whoa.
Yeah.
If Tom goes on vacation, we'll go up to 400.
Yeah.
Do you give priority to? Do you give priority to those that are in the hospital, or there's no priority? Whoever
There is
first
none.
come, first
The
served?
priority is the person that's in front of me. I also provide the service, so let's say we have someone that cannot come out because they are providing the care for their loved one. I do provide the service over the phone. I'm willing to provide the service in Teams, just to ensure that they have someone that is walking them through, because sometimes you can't always come out.
Melissa, you're here, you're not there, so you got like a volunteer, will you?
I do.
Very good question.
I do. So I started my day at work actually with a family, and then I have a volunteer that stays in the center that will have people come in so they can utilize the center. And if there's anyone that needs like a major referral, they will leave me a list. And so when I go back to work, I'll have a list waiting for me.
Thank you very much for what you do.
Before we end, a big part of the Goldstone Caregiver Center is self-care. So I'm just gonna ask you to participate in a small activity with me. I'm gonna ask you to close your eyes, and you are going to follow my voice. breath in.
Thank you.
Exhale out. Deep breath in. Exhale out. Understand that you belong here. Understand that you belong here. Understand that you are doing the best that you can. You are doing the best that you can. And lastly, you matter. You matter. Slowly open up your eyes. Slowly open up your eyes. Thank you so much. My name is
Thank you.
Melissa Alphonse.